Judge Ira Rabb, followed by Karen Holm.
Ma'am.
Hello, good morning. I'm going to speak on
Please take any
behalf...
conversations outside the chambers. It's getting difficult to hear the public speakers, and they have a right to be heard at this proceeding. Ma'am, you have 2 minutes.
Okay, thank you. I'm going to be speaking on behalf of children. Children, especially babies, are continually learning and using the constructs of their native languages, which is senses and nonverbal communication. Much of our communication is nonverbal, which includes facial expressions, gestures displayed, and the physical distance between the communicators. These nonverbal signals can give clues and additional information and meaning over and above verbal communication. Nonverbal cues create a world of safety for children as well as can be taught for emergency and dangerous situations. Some estimates suggest that around 70 to 80% of communication is nonverbal. Now we have the olfactory sense, which is our nose. It is said to be the strongest sense we possess, a sense many of us take for granted, but infants depend on it to recognize their mothers and mothers to recognize their children. Life mates are most often attracted based on a complex set of pheromones and other factors that help bond people to one another. Forcing people to wear masks will affect bonds between one another. When a person uses a face mask, all of the above gets suppressed because it is hidden behind the mask. Sometimes I can't tell if a person's happy, sad, angry, or even recognizable. So if I can't able to distinguish, how are children going to be able to distinguish that? Are you prepared to allow this mandate to harm babies and children's ability to meet, even exceed their potential to develop and communicate? We are social beings. How will children learn bonding if they continuously see only people's eyes and the 6 feet physical distance? What kind of guarantee can any of you provide that no baby, child, teenager, and anyone with a disability who is subjected to an intervention like this will not be physically, emotionally, and psychologically harmed? How will young children be able to know who the dangerous deviants are, like pedophiles and people in the human sex trafficking? Can you provide any significant evidence that the benefits of such intervention outweigh the risk? Where there's risk, there must be choice.
Thank you very much for your comments,
Thank you.
ma'am.
Learning what people want.
Lewis.
Criminal penalty doesn't. Now we have the olfactory sense, which is our nose. It is said to be the strongest sense we possess, a sense many of us take for granted, but infants